Today we're going to talk about feline arterial thromboembolism, or FATE, sometimes called a feline aortic thromboembolism or saddle thrombus. FATE occurs when a thrombus, most commonly originating in the left atrium or left atrial appendage, embolizes into the systemic arterial circulation. The classic location is the distal aortic trifurcation, where it suddenly compromises blood flow to one or both pelvic limbs. Most affected cats have underlying cardiomyopathy, especially hypertrophic cardiomyopathy, although restrictive cardiomyopathy and other diseases can also predispose them. Pathogenesis can be understood using Virchow's triad, blood stasis, endothelial dysfunction, and hypercoagulability. Left atrial enlargement and impaired atrial appendage contraction cause blood stasis. At the same time, endothelial dysfunction, platelet activation, and increased thrombin generation create a prothrombotic state. Once the embolus obstructs an artery, downstream skeletal muscle and peripheral nerves become ischemic, causing anaerobic metabolism, lactate accumulation, cellular injury, and potentially severe reperfusion injury if blood flow returns. Clinically, remember the classic P's: pain, paresis or paralysis, pulselessness, pallor or cyanosis, and poikilothermia. Cats often present acutely vocalizing, tachypneic, and unable to use one or both pelvic limbs. Femoral pulses may be absent, the affected paws are noticeably colder, and nail beds may appear pale or cyanotic. Tachypnea does not automatically mean congestive heart failure. Severe ischemic pain alone can cause profound tachypnea. Diagnosis is frequently clinical. Doppler ultrasound can confirm absent or markedly reduced arterial flow. Echocardiography should evaluate the underlying cardiomyopathy, particularly left atrial enlargement, spontaneous echocardiographic contrast, or smoke, and intracardiac thrombus. On blood work, expect elevations in creatine kinase and often aspartate aminotransferase from ischemic muscle injury. Hyperglycemia and azotemia are also common. Monitor potassium, creatinine, acid-base status, and lactate closely because reperfusion can suddenly release potassium and acidic metabolites into the circulation. A useful bedside technique is comparing an affected limb with an unaffected limb. Affected limbs have higher lactate and lower glucose. One recent multi-center study found a delta lactate of approximately 2.2 millimoles per liter or greater and a delta glucose of approximately 41 milligrams per deciliter or greater were highly discriminatory for FATE. Treatment starts with aggressive analgesia. Methadone around 0.1 to 0.3 milligrams per kilogram intravenously or intramuscularly every 4 to 6 hours, titrated to effect, is appropriate because these cats can be extremely painful. Antithrombotic therapy should begin early. Clopidogrel can be loaded at 37.5 to 75 milligrams per cat once, followed by 18.75 milligrams per cat orally every 24 hours. It irreversibly blocks platelet P2Y12 ADP receptors, reducing platelet activation and aggregation. An anticoagulant may be added. Enoxaparin, approximately 0.75 to 1 mg per kilogram subcutaneously every 6 to 12 hours depending on protocol, potentiates antithrombin and primarily inhibits factor Xa. Another option for ongoing therapy is rivaroxaban, commonly 2.5 mg per cat orally every 24 hours, which directly inhibits factor Xa. Combination antiplatelet and anticoagulant therapy is increasingly used in very high-risk or post-FATE cats. If concurrent congestive heart failure is present, minimize stress, provide oxygen when indicated, and consider furosemide at roughly 0.5 to 2 mg per kilogram intravenously or intramuscularly, repeated according to respiratory response. Routine thrombolysis with drugs such as tissue plasminogen activator remains controversial because hemorrhage and severe reperfusion injury can occur. For prevention, identify high-risk cardiac patients before they embolize. Cats with moderate to severe left atrial enlargement, poor left atrial function, low left atrial appendage velocities, spontaneous echo contrast, visible thrombus, or a previous FATE event should be considered for thromboprophylaxis. Clopidogrel at 18.75 mg per cat orally once daily remains a major first-line option and has demonstrated better secondary prevention than aspirin. The major takeaway is that FATE is not simply a clot in the legs. It is usually the catastrophic systemic consequence of underlying cardiac disease, and successful management requires rapid pain control, antithrombotic therapy, treatment of concurrent congestive heart failure, and vigilant monitoring for reperfusion injury. If you would like to donate to our game and video development or suggest topics, reach out to dogtoursgame@gmail.com.